Hello, everyone. My name is Jen Laurie, and I am a certified holistic nutritionist. And I am so excited to bring my friend Lisa Russell on today to share her experience where we're going to deep dive, expose some truths about the pharmaceutical world. Lisa has insider experience, knowledge, all the things. So I am so excited to bring her here to share her experiences, her knowledge, her learnings to all of you. Lisa has been or was in the pharmaceutical world working in hospitals for 25 years. You can only imagine all the experiences that she had in 25 years. And she also taught. She taught pharmacy techs. She taught nursing, and she also taught medical assistants. This woman has so much experience and knowledge stuck up in that brain. And we're just going to like touch on a little bit of the surface today. So thank you, Lisa, so much for saying yes when I heard about your experience, and I just really was like, oh my gosh, like people need to hear what you have to say because we live in a world where there's a lot of confusion, I would say. There's a lot
Agreed.
of confusion of what direction we should go when it comes to our health. And there's been a lot of controversy over the past few years with
Hmm.
some truths that I will say have been revealed about the industry.
Hmm.
And so today, what our intention is for this is really just to empower you with more knowledge so that you can be more informed as to how you can move forward with going forward with your health and knowing how to address certain questions and stuff like that. So, we're going to go through that. So, Lisa, first, before we get into the questions, what is there anything you'd like to share that maybe I missed just about like where your background is and you know,
Hmm. Really, no. I mean, pharmacy was my world. I mean, first of all, can I just give it back to you for
absolutely.
thank you so much for asking me to come on with you because even though we've known each other through Zooms and stuff, finally getting to meet you in person has been a pleasure. And I love your love for helping others. And I love your knowledge and your deep dive into research. So I think that us meeting, I'm glad it happened. So thank you for having me here. The only other thing that I've done, I started out as an elementary school teacher, went through a divorce, didn't make enough money, so I went into pharmacy. Loved it. I mean, I loved helping people. It was rough, seeing people die and stuff, but there was also joy when you know that they got better and they got to go home, right? Then I ended up teaching it, like you said, the pharmacy techs, nurses, and medical assisting, because I was just so enthralled into the drug world, prescription drug world. And then I thought, why not go on out there and look at street drugs? And so I went to get certification on drug and alcohol counseling. Okay. Combining the two together, I think has made me more aware of what's out there,
Hmm.
prescription and street, right?
Absolutely.
So besides that, I think that you've pretty much touched on everything, and I'm excited to talk about what we're here to talk about today, and that is pharmaceuticals.
Awesome.
So shoot me
Okay.
your
Okay,
questions.
my very first question for you is what were some of the biggest red flags? Because you're no longer in the pharmaceutical industry working.
No.
So what are some of the biggest red flags that you noticed during your 25 years in the pharmacy world that kind of just had you stopping and just kind of question a little bit and kind of just put you on like a pause? Because sometimes we see red flags and we're like, wait, I want to question that,
Hmm.
right? Like, is this the way it should be working kind of thing?
Hmm. So during my years in pharmacy, I actually did a position that's called medication reconciliation. And so what that is every person that comes into the ER or is admitted
Yep.
straight into the hospital, um, we have to go up and talk to the patients and we have to ask them, what drugs do you take? And when I say what drugs, I mean street drugs and prescription drugs and supplements. Okay.
Mm-hmm.
Because some people are on these supplements and then they're also on these prescription meds and they're doing the same exact thing. So they're double dosing. Some patients would give me their list of medications. And so we need to have a conversation. Okay, so you take this drug. Why do you take this? Most people did not know. So they're taking these pills religiously every single day, getting them refilled every month or every 90 days, whatever, and not knowing why they're taking it. The other red flag was, so there's two names for a drug. There's the brand name and there's their generic, right? So, and I'm just going to use this because everybody knows this one. So there's Tylenol and then there's acetaminophen, right? Okay, so some patients would tell me that they're taking this drug for, I think it's for my water weight, and can't pronounce it, doesn't know what both of the names are. And I think you should. I think everybody should know exactly what they're taking because not everybody talks brand name, not everybody talks generic name, and you need to know both. So when somebody says, "Oh, you take acetaminophen," you can be like, "Oh, yes, I do," because you know that that's Tylenol. Because if they say, "Oh, you take acetaminophen," "Oh, what's that?" It's like what you got to be educated on what you're putting into your body. And I saw so many people, so many patients that had no clue. To me, that's a red flag. You're not educating your patients the best that you can. You're just giving them
Yeah.
pills.
We often hear this term, trust the expert, and I think that's what shut off our curiosity and inquisition when it comes to this. Is I feel like we've been a little bit like we've had our power taken away from us
Hmm.
because we're indoctrinated to believe that we're not smart enough as like a general population rule, we're not smart enough to make decisions for our own health. We should just trust the expert. And I think where that's a little bit of where that falls
Yeah,
is that belief that we couldn't possibly know it. We didn't go to school for it. And so we're not encouraged by the systems, by the institutions to go do our own research.
right.
And I know there's stories, I have stories of times when I've had friends say to me, well, I went to my doctor and asked questions and they were really insulted and kind of shot me down. And I think that sometimes comes, and not all doctors are going to do this, but sometimes I think that's the ego, right? Like, how dare you question me?
Yeah,
Here's your prescription, go take it, don't ask questions. And part of that is I think the broken system of them not having enough time with their patients. Like here where we live, like doctors are given like 3 minutes per patient kind of thing. Like it's in and out, write a prescription, walk out. They're not always getting the full picture and there's no time to ask questions. And I think that can be a piece of the puzzle there.
yeah.
They're only human. They can only do what they can do. And I can't imagine the stress that they're under in the climate that we live today. So that
And
being
and you have
said,
and you have other doctors that do take the time. Like
yep.
I told you I went to the doctor yesterday just for a checkup, and he asked all kinds of questions. I was able to ask him questions. We went over things, and there's actually a doctor patient relationship
Yes.
there that's comfortable.
Hmm.
Not every doctor's that way.
Yeah, and depending on where you live, it can matter too, right?
Yeah.
Like where I live, there's not a lot of doctors that are even accessible. Most people where I live don't even have a family physician
Mm.
because of the terrible which way we're living. But that's not what this call is about. So
No,
let's
no.
get into
Okay.
the next question here. Um, which you kind of already answered. My next question was how common is it for patients to be on medications they don't actually need? So it's kind of
Actually
about what
need?
you were talking about. Yeah.
Yeah.
How common is that?
Um, it's pretty common.
Need being, and when I say need, I mean like there's no other options. They need this medication.
Yeah.
It is
That there's a
it is
difference
life or
between
death,
needing and just
right?
throwing something at them.
Yeah.
Like I was told by a friend that they went to the doctor, their friend went to the doctor, and because they were of a certain age, they just needed to be prescribed this med. I just heard this story, right? And I'm like, well, wait, was there blood work? Oh no, there was no blood work. But just because they hit a certain age, they have to take this med.
Hmm.
But they didn't test their levels to see if they needed the med. That makes no
Not
sense.
adding up. It's not adding up.
Makes no sense. So there are so many patients that I think, just like you said, the doctor's the expert. I got to ask my doctor. I got to talk to my doctor. I don't care if I'm on 42 different meds. He said to take it. So, yes, I do think it's extremely common that patients are on medications that they absolutely should not even be on.
Interesting. Okay. Um, this kind of goes right. It just like my questions just lead in here. So
I love
stick with
that.
me here. So can you explain polypharmacy and why it's so dangerous?
Well, I mean, yes, you can take different medications together. Okay. For example, if you are on a depression med, and it's just not, and you're really, really depressed, okay? And it's just not taking taking that edge off like you really need, they may couple it with another depression med that synergistically boost that med.
Okay.
Okay, that makes sense. It's been tested. It's been it's been used together before. The results 100% outweigh the bad results, right? The good results.
Mhm.
Um, but how dangerous is it to take multiple medications? You don't know because this med was tested with this med and it's perfect.
Okay. That kind of goes into my question because
Okay.
this is where I was going with this. You're right on the right track here because when my kids were little and we were seeing a naturopathic doctor, I had this amazing naturopathic doctor that was also a pharmacist, and we were
Hmm.
also working in some specialist doctors. We were working with a doctor that was like head of the Tourette's clinic. We were in some like other things that were in another like specialist office. Anyways, I know we got viewers from all over the place, so the names aren't going to matter.
Yeah.
But we were on this journey, and it was just perfect time. I was in school getting my certification in holistic nutrition at the time, so I was really able to vocalize these questions in ways. And my naturopathic doctor knew that I was in school at the time, so we had some insider conversations. And
Hmm.
I just loved that she was also a pharmacist because she could speak to me on both sides, and I really think both sides are equally important and not always given the same amount of importance in our
Right.
system, in the current system that we live in. And at the time, one of the doctors wanted to put a fourth medication into my son because the three weren't working. I was
Oh,
like,
goodness.
so I went to her and I said, okay, I need help with a conversation with this doctor because I do not feel safe adding another medication when we already have three in there that aren't working. It doesn't make sense. It's not logical for my logical brain. I was like, my
Hmm.
logical brain says if this med's not working, we should take it away before we add another one. If
Hmm.
this med's not working, we should take another one away. Like, if all three aren't working, adding another one doesn't seem like the logical next step. And what
Yeah.
she told me was, and so you can tell me if this is correct or not from your experience, but what she told me as a pharmacist, they often have conversations about how unsafe the pharmaceutical regime of a person might be for them, because there has never been testing where more than two medications were tested, like clinically tested at the same
Hmm.
time. Which means, so for those of you watching who are like, what the heck is she talking about? Think of like this medication, and this medication here. We've got a triangle of medications. This one was tested with this one, and this one was tested with this one, and these two were tested, but never has there been a test where more than two at a time have been clinically tested, which therefore means that anytime we are on more than two medications at the same time, we are a complete guinea pig because we don't know the chemical reactions. And because we're all biochemically unique within ourselves as humans, it really is a guinea pig experiment, and some people are on upwards of 15 or more medications that, and I've had situations where I've worked with people who are on tons of medications, and it's the medications causing their symptoms. And when we start working with the doctor to get them off the medication and get like habits and nutrition back in their body, these symptoms that they thought were disease was actually side effects from all these
From the
chemicals
medications.
mixing in the body.
Yeah,
And I think this is a really important conversation because I don't think people in the general public are understanding of this when they're trusting the doctors in the pharmaceutical worlds and what might be happening in their body because they're desperate to feel better.
exactly.
And
They
I
want to trust them.
understand that desperation and not having the knowledge to move forward. So, um, this is why it's so dangerous,
Yeah.
right? Like, would you agree? Like, because you're nodding your head. So I'm assuming like this is correct in what she told me.
Yeah. Oh, it
Drugs are
is.
not tested in a way where multiple are tested at the same time too. So there's no safety data. There's zero safety data when
Well,
combining
there
more than two
is.
medication.
There is, but for two medications.
Right, that's what I mean. That's what I mean.
Yeah.
No safety data when there is more than two medications involved. We actually don't have any data to prove that that is a safe thing.
Not that I know of, and let me tell you, I have done lots of research. I mean, to teach it, you got to be knowledgeable, right? And I do not know of any clinical trials, me personally do not know of any
Mhm.
clinical trials that have been performed that just test multiple drugs going together.
Mhm.
Two, like I said, that
Yep,
depression
the
med to
two.
piggyback, yes, they work together. Wonderful. People are getting results. Adding a third one, adding a fourth one, I just don't know of any clinical trials.
Mhm.
So,
So it's just something to be a mindful of when
yeah.
you are on multiple medications, that there's some chemical reactions that can be happening in the body that we aren't, that hasn't been studied, that
And
hasn't.
also, every single prescription, and I could even throw a supplement into it, every single drug could possibly have a side effect with your body because of your biochemical makeup.
That's right.
Okay. So if you think about putting multiple prescriptions into your body, you can have multiple symptoms of side effects, and you don't know which one is doing which because you're taking them all together.
That's right.
You pretty much have to stop everything with a doctor's
We're not saying
guidance.
to go do that.
Yeah.
Let's be clear.
And then gradually add it to see, is it's just like a food allergy. What
That's
are
right.
you eating that's making you
What's doing
break out in
what?
hives?
What's
Well,
doing
cut
what?
out everything
Yep.
and one at a time.
Right.
A lot of people don't do that. They just keep taking them
Hmm.
and then keep dealing with the suffering of whatever side effects they are because they don't know.
Yeah, exactly. Okay, what is something that the general public assumes about prescription drugs that just is not true?
Um, how do I say this? You don't always have to do or take what the doctor says. You have a voice. You need to be an advocate for yourself
Mhm.
and ask all the questions. And if you're still not getting the answers, it is okay to put that doctor on the back burner and go somewhere else for a second or third opinion.
Mhm.
You have to be comfortable with what you're hearing to know that you're taking the meds for a reason. You're taking the meds to improve
Mhm.
and not putting a bunch of chemicals or synthetics into your body that's really not possibly needed. And I'm going back to the story I heard about just because they were a certain age, here, take this pill.
That's right.
Makes no sense. Advocate for yourself, speak up. You have every right to ask the questions. And let me tell you, if you can't get the questions from the doctor, go to your pharmacist.
Yes. Yes. I always say that because, well, how much do doctors really know about medications that they prescribe that they like and how much of their knowledge actually just comes from pharmaceutical reps, like sales
A
reps?
lot, a lot. Doctors go to school to
Yep.
diagnose and treat,
Yep.
right? And to prescribe. But pharmacists go to school to learn all the drug interactions, all the side effects. Um, when you see the advertisements for drugs on the TV, at the very bottom, it has all of these do not take if, right? They have to throw that in there. One, because there was one person in the whole world that had a side effect. So they have to throw that in there. Okay. But also, doctors don't know every single side effect. And I'm not poo-pooing on doctors. Doctors are fabulous. They're educated. I respect them. But they're not taught all of the interactions, all of the side effects, what not to take with this. Pharmacist does. I mean, doctors will literally write, well, when I was in the hospital, they would write orders, their medication orders, and it would literally say dosing per pharmacy, which means I have no clue how to dose this patient. Can you please do all the math for me and make sure I don't kill this person? I mean, that's a bottom line,
Well,
and that's nothing
that
against the
seems like a
doctor.
responsible thing to do. Like a
It's
doctor
very
to know their
responsible.
limitation
Yeah.
and put
And
it in
I love that.
the
That's
plan.
why I respect some,
Yeah.
doctors that
Yeah.
actually care and they want to make sure they don't hurt anybody.
Yeah, I've never actually, you're the first person to ever tell me that. I didn't know that was even a thing. I don't know that that's ever happened in my experience. But I mean, I don't have every experience in the world, and I don't know if this happens just in certain places. I don't know if this is a thing in Canada. I've never seen it happen or heard of it, but it's good to know. It's good
Well, when I worked in
information to know.
Tennessee, it was the same way.
Yeah.
Tennessee, Oregon. I mean,
Yep.
here in the United States, I haven't worked everywhere, of course, but I mean, in the two states that I have worked in, 100%, we would get dosing per pharmacy. And again, there's nothing wrong with that.
No.
Kudos to that doctor
No,
that
that's
said, "Oh
good.
my
I
God,
see
my
that as a
brain."
good thing because I hear nightmare stories of doctor error with prescriptions and there's many people who have lost loved ones because of
Mhm,
that. And
mhm.
so like that's a really respectable thing to do for a doctor, like to kind of know where their limitations are and just like
They're
that
human.
it's like an extra layer of protection
Yeah,
for the patient, right? I think
absolutely.
that that's an honorable way for a doctor to prescribe if they really know where their limitations are. I think that's an important thing.
Yeah.
Um, let's move on to the next question here. Have you seen cases where someone's health declined because of their prescriptions rather than improved from taking their prescriptions?
Well, yeah, I think that I've seen that a lot, and it's not really an error for the doctor. It's not really an error because of the patient, but it's kind of everybody's fault. Again, because number one, the doctor needs to be knowledgeable. Number two, the patient needs to advocate for themselves. Number three, the pharmacist. Well, I mean, I don't know about you guys, but when I go to pick up a prescription, whether it's an antibiotic or, and even with my knowledge of pharmacy, they counsel you,
Mm.
right? Or you can decline it, but they counsel you. I
Yeah.
always let them counsel me.
Yeah. I'm
I'm
always
not going to
like, I'm
say,
the
oh,
one
don't.
that takes like the big sheet home and
Yeah.
reads through it, right?
Well, I would do that if I didn't like kind of know, but I do get the sheets and I do get the counseling because what if something has changed since I've been
That's
out of
right. That's
pharmacy,
true. That's true, right? Like they're
right?
actively working in the
In
industry.
the
So,
industry. And
yeah,
and the good thing too is whenever I mean, I only take one prescription medication. I'm very blessed. I don't have to take anything else, and only because of some trauma that I went through, right? I have so many accesses to pharmacists that all I have to do is text, call, or even go to their house for coffee and say, all right, tell me about this drug, or tell me about this new FDA warning, or tell me this, or tell me that, because I'm not in the loop with the Board of Pharmacy
that's
anymore,
right.
but I'm in the loop with all my friends.
Yeah. Well,
So I have that
we have
access.
some pharmacy techs and pharmacists in our family, Mark and and I remember had an allergic reaction to an antibiotic once. When I was nursing one of my babies, I got mastitis and I had to be on an antibiotic, and I had a really bad allergic reaction where my whole face went numb. And I was like, I don't know what's happening. And I was like, I don't know. And like it was after hours, and I was able to call, and I was like, okay, stop taking immediately was the suggestion.
Yep. Take
I was like,
Benadryl.
okay, yeah, we'll do that. So apparently I have allergic reaction to a specific antibiotic, but yeah, it is good to have people in your lives that
Oh,
have
heck yeah.
multiple skills, right? We want
Yeah.
people in our lives that have multiple skills. And so, yeah, it is really great to have access to that because we just never know. But here is the big burning question I have for you.
Uh-oh.
Are there any prescription drugs on the market today that this is your personal belief is not, this is just your personal belief that should not have been approved?
You're putting me on the spot, Jen.
I know. I can think of a couple myself, but
I can think of a lot.
well, and I think of medication, like when I think of this question, I think of medications that there's alternatives that are safer that are available. And like prescription should, in my opinion, only be used when there's no alternative. Because we know that with prescription use, there's always possible risks. And we need to be given informed consent because there are risks involved. And we always need to be doing a risk benefit analysis with, you know, multiple information, like streams of information coming at us
Hmm.
before we decide to put something in our body that is not natural and like should
Absolutely.
not be something like, like an apple. Something that is synthetic, something that has a chemical makeup that could interact with our body. Like we
Yeah.
need to have all the information, know what all the risks are, what the possible benefits are, all of the things, right?
Right.
And and of course we need to be monitored. But there are a lot of medications that I see on the market that I don't believe pass the risk benefit analysis when because there's alternatives out there. So if you could name just one
Well, I don't want to get
or
shot.
right,
Um,
you're going to need to go into protective custody.
I guess so. I think um just one. I'm gonna say Ozempic. And the only reason I say that is because I know that there are diabetics out there that need help. I know that
Hmm.
100%. Unfortunately, it has been abused in the wrong manner.
Hmm.
And even the people that absolutely need Ozempic, before we found out there was other alternatives, right?
Hmm.
They went into it to get it for either weight loss or for their diagnosis,
Blood
right?
sugar management is typically
Yeah.
what it's used for in
And it's
the
going to
case
help
of
them.
diabetes.
Exactly. It's going to help them.
Yeah.
But did they know it was going to tear up their gut? Did they know it was going to help their muscles
Well, and
deteriorate?
that's it, right? Like for and what I'm seeing is that it can seem like it's going fine, and then all of a sudden it's
It's
not.
not.
And sometimes we're not connecting the dots. Like one of my friends almost like she started losing her hair, like she almost went bald, and she had to have a foot of her intestines removed because of the paralysis and the blockage that it
Mm,
caused. And through the use of our Enrich, it's changed her life, and she didn't
thank
end up
God.
having like a colostomy bag and stuff, thank God. But like she was not told of this risk.
Hmm.
There was not a conversation that was talked about with this risk. And this is really what I want to press on here is that whole risk benefit analysis needs to be done, and it needs to be done by you and you with someone who you wholeheartedly trust has enough information to give that to you.
Hmm.
And you can ask for the product insert and all of the information before you even fill a prescription.
Absolutely.
And so you can go do research before you even go on a medication. And there has been times where we've used medications in our family where I did not do my due diligence, and we 100% have regrets, and long-term damage was done. And that's why I am so passionate about this conversation is because I did not have due diligence where I should have, and there is long-term damage because of the decisions I made and accepted because I trusted and and so I think it's really important that we have this conversation because I want to prevent it from happening to someone else.
Yeah.
And moving
100%.
forward, I know this and I am will always be more diligent about it moving forward. But I just think that more people need to understand how important it is because some medications can cause long-term irreversible damage and you can't go backwards. You can't go backwards, especially when, unfortunately, for in our situation, they were not necessary medications, but we
Right.
didn't know at the time.
Well,
And
and the you said something about not knowing what the side effects were, right? I'm going to be honest, I don't know that they knew it was going to, cause muscle deterioration. You know what I'm saying? It's
no,
like
well,
maybe they didn't know, so they couldn't put that out
well,
there.
and maybe that conversations goes back to like we need to, as a public, we need to demand better safety data before things are approved.
Well,
Because
clinical
I think
trials that are longer
things are being approved without
like
knowledge of
this.
long term.
Yep.
Right? Long-term damage, and everything is retrospective. And we're getting like you hear of drugs being pulled off the market, but how many people are injured or killed before
Or
that
they do it.
happens? Because science is slow, right?
Yep.
Science is slow, and we're so desperate to have that quick fix as a society. We need to
Hmm.
take that control back and realize that prevention is key first of
Absolutely.
all, not like having that knowledge. But let's take this to the next question here.
Okay.
If someone is prescribed new medication, what is the best questions they should be asking their doctor before accepting it and taking it?
So, number one, I would ask if you're on other, multiple medications, I would ask, is this going to interfere or interact with my other medications? I would ask that first because the doctor doesn't know what you're on at that moment.
Mm.
It's going to make him go look at your chart and see exactly what medications you're on. Or he might even say, oh, well, what other medications do you take? That's a red flag. If he's coming in to see you, he should know what medications you're on.
The chart's
Okay.
there. The chart's there, right? The
I mean,
database.
the chart's right there.
Yeah,
You should review it. Okay, I'm going in to see Miss Russell. What medications is she on? Okay, what is
that's
she here for?
that's right.
And then start from there. So that's the first thing is, will this interact with my other medications to make sure that the doctor is aware of exactly what other medications that you're on? Because he may look and be like, oh, no, wait, you can't take this one. I forgot, which he's not going to remember everybody,
No, no, but the
but
chart's there.
yeah, I forgot, or okay, I see you're on this. No, we need to think about something else.
Right.
Ask the questions. That's the biggest thing. The very first thing I'm going to tell patients is communicate with your doctor. Don't be scared to ask questions. You are advocating for your own health. So,
Mhm.
yes, ask them, will this interact with my other medications? Second question, are there side effects that I need to be aware of? I do a lot of traveling or, like for blood clots and stuff. I'm on a blood thinner. Is this going to make, you can't take blood thinners and aspirin and ibuprofen. Like you can't do all that because you can bleed out, right? I'm on IVIG, which is a blood replacement. Can you take it with that? You have to make sure that your doctor is very well aware of what you're on. And that's when you're going to come up with, is this going to interact with this because of what I do?
So my question here would be, should they just take, if they ask about possible side effects, should they take what the doctor says or go do their own research?
Oh, go do your own research.
And where would you find that research? Where
Oh,
is the best place to do the research to learn about side effects, possible side effects of medications?
go to the FDA website and search the drug names.
Okay. Or what I was thinking is like going to the pharmacy and just like ask for
Oh,
the
you could go to
insert
the
of the drug.
pharmacy,
Like ask for
but
the insert of the drug, or you can probably go online and look up the insert.
and you
It's,
can get the insert there
you can get the
too.
insert there.
Do not talk to Dr. Google. Okay. He did not go to school and he just tells you what you want to hear. Do not go to Dr. Google.
What would you say if you were in a doctor's office? This happened to me. This is why I'm asking it. Bring a new
Uh-oh.
one on you. What would you do if you asked a question to your doctor and your doctor used Dr. Google?
I would say, thank you. I'll be leaving now. I'm not going to stay with the doctor. And I'll tell you something else too. If a doctor ever says to you, I don't know, and follows it up with, and doesn't it up with, but I'm going to find that answer for you. Hold on just a second. If he simply says, I don't know, go to another doctor.
Okay.
Because if he's treating you and you're sitting in his chair and he's listening to your heart and listening to you breathe, and then he says, I don't know about something and doesn't come back with saying, I'll find out for you, he's not there for you.
Hmm. Okay.
If he doesn't have the knowledge, he needs to go get the knowledge. But if he's not willing to say that and come and help you, and that's probably going to piss off a lot of my doctor friends, but it's true. I think my doctor friends would even say, if a doctor says, I don't know to you, you're with the wrong
Well,
doctor.
I think if you have a doctor, like a family physician that you've been seeing for years, like you expect that there's some sort of relationship there. And we're not really addressing the broken systems right now. Like where I live, nobody has a doctor. So that's like
Yeah.
a whole nother conversation of broken system. But you should have a relationship with your doctor where you can have a conversation. There's some history. And when you go find a new doctor, doing an interview and choosing whether or not, like it should never be, I mean, you're interviewing each other to a degree, but
Hmm.
know that you have choice and you get to choose your health team. And I'm a big advocate for having a health team, not a doctor.
Yeah.
A doctor is a piece of the team because we can't leave it in one human's hands ever. I think it's important to have like a team of experts versus
Yeah.
one expert because there's no one expert in the world that's going to give you like a completely unbiased way of, because we all have bias. We are humans.
Right.
We have bias from our experience, our knowledge, and our emotions,
Yeah.
right? And
100%.
I'm very aware of my bias. And though that's why I say we need a team. And I
Yeah.
always tell people, like, you don't have to trust what I say. I understand I have a bias. And though what I do say has value, take it and go do some research and go talk to
Exactly.
other health professionals. And then you decide what's best for you. I have some people that get mad because they're like, you don't get it or whatever. I'm like, hey, I'm just giving information from what I've
Exactly.
learned. You take from it what you want and you decide what's best for your body. I'm not telling you ever what to do. I'm just giving you information from my learning so that you can take that little bit of information and use it in your toolbox
Hmm.
of information, and you get to decide what you want to take from me and what you don't want to take, and it's your life and it's your, like, you get to be in control of your life. And
Exactly.
I want people to understand that because I think, like, I'm just here to share and help as many people as I can, and as are you. And
Yeah.
so like, take everything we say and we empower you to, like, go do research.
Absolutely.
And if I'm ever like, if I'm completely wrong about something, like, I don't mind having a conversation about it. I
Yeah.
might get
Come
my
tell me.
ego bruised a little bit, but I will, I there's been things that I have said in the past that I no longer believe today as I learned and grew on my journey.
Yeah.
And so, that being said, like, I will share those things when I'm on social media and stuff. I actually did that, in fact, today. But there's things that I used to believe that I now have a clearer understanding on and can share from my perspective today. So,
Yeah.
um, always take whatever you hear from anyone. Don't ever take anything as gospel. It always, like, just take it and use your critical thinking skills to identify what you want to take from it.
Yeah.
Um, okay. Let's move on here. Um, okay. What are some alternative approaches to healing that people should be considering before resorting to pharmaceuticals? So you have moved away from the pharmaceutical space
Yes.
and found a different career path.
Hmm.
Why don't you tell us a little bit about that journey and how that relates to this question?
So I lived, breathed, ate pharmacy. And to this day, I can still rattle off drugs. I can still pronounce them perfectly fine. My family and some friends still reach out to me and say, "Hey, what about this?" My daughter-in-law, he's got a fever. How much? So it's in my body. It's instilled in me, right? But I was over it. I was done. Um, Politics in the medical world is kind of crappy sometimes. And I was just done. I was ready to do something different. And so I actually went to work for Department of Human Services here in Oregon and was the family finder for kids in foster care. As fulfilling as it was very traumatizing to me, and seeing the child abuse cases and child neglect and the deaths and
Mhm.
it was a lot for my mental health. A good friend of mine reached out to me about this company that you and I are in and talked to me about the Enrich. Just saved my gut. I'm not going to say it saved my life because it wasn't detrimental like that, but it saved my gut and
Mhm.
helped me with my food and being able to live life happier, right? Transitioning from a pharmaceutical world into a supplement world is different with us. And I'm sure everybody's like, of course it's different. You're promoting your company. You know what I'm saying? No. Supplements that are over the counter at Costco's or Walmart's, whatever, those are synthetics. You're still getting the synthetic drugs, right? Our supplements that I 150% promote is because They're plant-based, they're methylated, they're chelated, and if you don't know what that means, go ahead and go to Dr. Google. I'm sure he can tell you. Um, but they're made to absorb into a human body. Synthetic supplements are full of placebos or dyes or other chemical names that helps hold them together. Did you hear me say chemical? Chemical. That holds the drugs together, the drug together so you can take it. You're peeing most of that out because you're not absorbing it,
Okay,
right?
so I have to do like I'm gonna do a bashing here because
Uh-oh.
like I often do like new supplement comparisons in education. This is what I do. It's like I really love it. It's fulfilling to me, and I love being able to direct people to something that's going to actually make a difference for their life.
Mm-hmm.
And the brand name that I'm going to throw under the bus right now is Centrum.
Mm.
Because Centrum has all the marketing of doctor's number one multivitamin on the market.
Yep.
And I hadn't looked at the ingredients in a while. And so I had forgotten what it was. And I was ready to just do some education. And when I went through ingredient by ingredient, I was like, my goodness, this is actually toxic.
Yeah.
It is actually doing more harm than good. It is so completely toxic. Please, 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 if you need a better multivitamin than that, you'd be better off not taking it. Like,
Yeah.
and I don't say that lightly. Like honestly, it's so toxic. Every ingredient in it is going to harm your body.
Somehow, some way.
The form of the synthetic vitamin, like it's not just a synthetic vitamin, but some of the forms of the minerals are actually completely useless. Like the form of magnesium they use is nothing but a laxative.
Yeah. Yeah.
Like, my goodness, never mind the fact of what you just said with it being a compressed tablet.
Mm-hmm.
If you even access any of the new, like you probably don't access any of the nutrients. Some of them, they're just coming out in your poop hole because
Yeah.
your body's not even breaking it down. If you have any gut issues, you're not breaking it down. Trust me. If you don't
Yeah.
have good gut health and maybe you got heartburn, so you've been on antacids your whole life, trust me, there's no stomach acid in there to break it down. Um, like it is more complex than that, but I needed to throw this under the bus because there's so many people are going and buying it because it's cheap. It's at Costco and it says doctor's number one recommended
And
multivitamin.
you're supposed to take a multivitamin, so better take it.
And so I just want people to understand that that is a bought and paid for advertising on the bottle. Doctors that do recommend it don't have any education in nutrition if they are recommending it because they've never looked at the label or they just don't have the training and to actually give that recommendation
Mhm.
because the amount of additives that are toxic in it is mind blowing. The forms of the vitamins are actually liver damaging, and a lot of the minerals are completely useless because of the forms of the minerals they're using.
And it's not going to absorb.
No. And so, oh my gosh. Okay. Anyways, that's my little rant on that. I couldn't not do it because I know so many people are on it and it's so, so, so bad. And I
Yeah.
was so mind blown when I was breaking it down. I was like, oh no, it can't get worse. It can't get
Oh,
worse. It
it can
just
go
got
worse.
worse. I was like, I do a lot of comparisons and there's a lot of like useless supplements out there,
Hmm.
but then there's something like this that is actually dangerous.
It's, yeah.
And so some people like they think aging is what's causing their gut health issues, and sometimes it's the supplements that they're on, unfortunately.
Yeah.
So, Walmart and Costco and any big box store is not the place to purchase most supplements. And I want to caution Amazon because
Oh, even Emma.
there has
Yeah.
been reports of supplements on Amazon being like fake. So, what's inside the bottle is not what's on the label.
Right.
And
There's
that
not
can be
transparency.
very dangerous because you don't know who's selling it and who packaged it. And that can just
Exactly.
use caution when it comes to that. Um, if someone wanted to start reducing or eliminating unnecessary medication safely, what would be the first steps?
Well, okay, I have to say this. You need to talk to your doctor
Yeah,
and tell them
absolutely.
that you would like to get off of this medicine. I have a friend who was on so many different medicines and like high doses of them because of his ailments.
Yeah.
And he did the good thing, thank God, and talked to his doctor and actually got off of almost all of his prescription meds and was able to supplement his body and feel better with supplements.
What I like to refer to as therapeutic nutrition.
Okay, therapeutic nutrition. That's a new one. I might be using that from now on.
Well, I actually have the a certification in therapeutic supplementation.
Oh, okay.
It is like if you, and what that is for anyone who's like, what the heck even is that? First of all, like I have training in reading the ingredients and formulations,
Mm-hmm.
but not only that, um, most times a person is just going to be like, take the recommendation on the bottle. Therapeutic supplementation is like knowing the levels that will give therapeutic results versus
Oh, yeah.
maintenance results.
Oh, I like that.
Knowing the different levels and the safety levels of what supplements actually have a toxicity level, what
Mm-hmm.
supplements don't have a toxicity level, and what those levels are.
I like that. Okay.
And so that's kind of like a little bit of my expertise. So my passion and love is like, let's like get you on the right dosage to
Mm-hmm.
get the desired results as fast as possible too.
Exactly. Yeah.
So anyways, we're going to wrap this up. We are going
Okay.
to wrap this up pretty soon, right away here, because we have gone on longer, but this is such a great conversation. And it's really just the beginning of this conversation. I feel like you and I are going to, um, we might have some follow-up conversation
Oh, yes. I think we
on
will.
different rabbit hole directions we could go with all the different experiences and knowledge and things that we've had. So
Mhm.
stay tuned if you're watching. Like we may do another one. And if you want to hear more from us, please reach out to us and let us know that you want
Oh,
to
yeah.
hear more. If this was helpful, please let us know if this has been helpful for you because we sometimes don't know what we don't know, and we don't know if for sure that this is like information that you don't already know. So
Yeah.
let us know if this is helpful so that we can continue educating and sharing our own experiences and knowledge. And so the last question I have for you, Lisa, is if you could give people just one piece of advice when it comes to prescription drugs and their health, what would it be?
Oh, that's easy. 100% know what you're taking and why you're taking it.
Okay, that's good. That's legit.
100%.
That's legit because, like, a lot of times when I'm working with a new client, I need their full medication regime
Mm-hmm.
before I can create a nutrition plan for them and all of that. Um, it's part of my intake forms. Like, I need to know what all the medications, and I see the same thing as what you saw
Mm-hmm.
is a lot of people don't know what they're on and they don't necessarily know what it does or why they're on it.
Exactly.
And that is a really empowering like info a thing to place to start
Mm-hmm.
is to know exactly what medication, what it's supposed to be doing in your body and knowing what possible side effects are so that if you do have a new symptom pop up, you can make
Mm-hmm.
the connection and then you can ask more questions about it. Because what I see often is symptoms of medications happening, but people don't connect the dots because they're not aware of this possible symptoms.
Right.
And then it gets blamed on a different potential diagnosis, which can lead to another pharmaceutical
To
that
fix
would be
that.
that would
Yeah.
be unnecessary, right? And or it can get downplayed as aging,
Yeah.
a natural symptom of aging, which often happens with a lot of symptoms.
Hmm.
And I think it's really important. And where the story I have that taught me this is once upon a time in my multiple years of journey through diving into learning and understanding through the experiences we had, my son was um, in a hospital program at the time. And he was being basically a guinea pig to different medications to see what cocktail would work for him. It's not something I would recommend doing, but it is the journey that I was on at the time and where I was at. And this was like 15 plus years ago. And when he was in there, I'm like a ingredient nerd. I'm a manual reader. Like when you get a new device in your house, do you ever read the whole manual? I do.
I'll be calling you then.
I'm the
So that way.
weirdo. We got the motorhome and it's like 193 pages and I read through all of it.
Oh
So
my gosh.
anyways, I'm a manual reader. It's just who I like to know all the things about all the things. Okay.
Yeah.
And so I read through the pamphlet of a medication he was on and he was having a symptom and I pulled him off that medication right away. And so he wasn't on it for very long and that symptom stopped. And when I went to the doctor and I shared why I took him off of it because of this symptom, she said to me, and this is when she lost all credibility,
Mm.
she said to me, it's highly unlikely it was from the medication. I was like,
You
it's
have
actually
proof.
the number one side effect.
You have proof too. Yeah.
I was like, it's actually the number one side effect. And she actually argued it to me and said, it's so unlikely that that's what was causing it. And I'm like, I don't trust you with anything. I need to get my son out of here now. Like
Yeah.
in a moment, she lost all credibility and she was a highly sought after doctor where we live and working with many children.
Mm.
And that frightened me enough to start digging into the system and
Yeah.
understanding the system better and understanding that I needed to be a better advocate for my family. And
Good
so
for
that's
you.
just one scenario of
Yeah.
a situation that taught me a valuable lesson. And though I apparently needed to learn it some more times. So unfortunately, things still happened in the future, but it's solid in my mind now, and I don't believe I will ever fall for the fear tactic of a medication before doing my research first.
Good for you.
But just know we're all human doing the best we can. And
Absolutely. Yeah.
again, this whole conversation is about teaching and understanding that you need to be your best advocate for your family and you always have bodily autonomy in what goes into your body and no one if anyone is pushing fear that is not the time to say yes.
Right.
Do more research. If you feel at all being feared into something that is wrong, and you should never be feared into taking any sort of treatment or medication, and you should be given the time to make decisions for yourself.
Amen.
That's it. Do you want to add anything before we say goodbye?
Just please, people, advocate for yourself. You are your nobody else is going to advocate for you bigger than yourself
That's right.
and be in the know. So that's my biggest takeaway from this.
Awesome. Okay. Thank you so much for your time. I look forward to talking to you again soon.
Yes, I look forward to this. This was fun today. Thank you so much.
Okay. Bye.
Bye. Have a good afternoon.